If you think that you might have POTS, I'm going to break down the symptoms that are commonly felt by people that are diagnosed with POTS. Hi, I'm Chandler. I'm a naturopath. I help people with POTS to reduce flares and improve their quality of life. So POTS stands for postural orthostatic tachycardia syndrome. Our major symptom that's going to point to whether or not we have POTS is the change of symptoms from lying down or sitting to standing. So that's our postural change. So we feel worse on standing and better for lying down. The other major symptom, which is tachycardia, so that is our racing heart and our really strong heart palpitations. Also can feel things like dizziness. So on standing, we might get lightheaded or dizzy. This can also present as fainting or near fainting for some people, which you might black out, you might see stars on standing. Then you can also see low or high blood pressure depending on the presentation. We have neurological symptoms, so things like brain fog, poor concentration, poor memory. Then things like headaches and migraines are super common, and you might feel tremors or shakiness in your hands. Digestive symptoms, so it's pretty common to feel nausea. This can be from the adrenaline dump that occurs when your heart rate rises as your body tries to bring that blood back up to your head. This can also be from something called gastroparesis, which is basically your stomach digesting and emptying your food into your bowel at a slower rate than what would be expected by your stomach. This can cause issues like constipation or diarrhea, and also just general nausea, bloating, and can also cause abdominal pain. So we also see a lot of fatigue in people with POTS. So this is severe and persistent and not remedied by how much rest you have. Feeling totally wiped out by a small exertion, so you might run up some stairs, you might run to catch a train or a bus, and it absolutely wipes you out. This can also happen when you mentally exert yourself, so do something that's mentally challenging or mentally stimulating for you. This can wipe you out as much as a physical event. Heat intolerance is super common too, so things like a hot shower or being out on a summer's day can really affect our system. This is due to poor temperature regulation found in dysautonomia. Some other common symptoms are excessive sweating, increased urination, and in turn an increased thirst. There's also a high link between having cold hands and feet. This is due to our circulation issues occurring because of the way that our blood is flowing and not flowing in our system. There's lots of things that trigger POTS, so you may have these symptoms sometimes and not others, and are wondering why or if you have POTS. So some major triggers, if you're a woman, it is your luteal phase, and the first few days of your period can be really triggering for POTS. In turn, if you have histamine issues, it can also give you major symptoms if you're having a histamine reaction. Then we have things like eating a large meal. So eating a large meal can take all the blood out of your head and go into your stomach to try and digest this food and absolutely leave you wiped out. We're having our blood sugar dysregulated and having lots of high blood sugar crashes. So we're only eating carbs, we're not having any protein or fat. This is going to absolutely put a lot of stress in our system and can really flare up POTS. Also getting sick. If you have a cold, this can majorly flare up POTS. And just general dehydration. If you're not hydrated, if you're overhydrating and experiencing a lot of water and mineral loss, then you can worsen your POTS symptoms as well. So there's a lot of variation of POTS symptoms, and the major ones that are going to define whether or not you have it are the postural changes of you standing up and feeling bad and laying down and feeling better, and also the tachycardia. These are things that have to occur for you to be diagnosed with POTS.